Hi, I'm Dr. Emma Craythorne, consultant dermatologist and founder of Klira. I want to talk a little bit today about photoaging. Now, photoaging, photo meaning sun essentially, sun energy, and aging, well, we all know what that means, are changes within the skin that usually ultraviolet light has induced. Those changes happen to everybody, but they happen with escalating amounts in people who are exposed to the sun to a greater degree. The typical changes that we would see in the skin as a cause of photoaging are fine lines, wrinkling, coarse wrinkling, sallowness, pigmentary dysregulation. In other words, the skin is more blotchy than it should be. You might see darker marks appearing in the skin, sometimes thicker marks. They may be dark to start with and then thicken up. For some people, they get telangiectasia. Now, these are visible blood vessels, and the visible blood vessels often occur around the nose or in the mid part of the cheeks. These are all signs of photo damage or photoaging. Now, when it comes to trying to see what we can do to prevent photoaging, well, that's easy. It's protecting ourselves from as much of the ultraviolet light as possible. And that's including sitting in my office while you have this ultraviolet beaming through the windows, is wearing sun protection every single day, whether you're inside or whether you're outside. In addition, you can offer yourself additional protection by putting antioxidants on the skin, and there's some evidence, although small, of taking oral antioxidants. But is there anything that we can do that can actually reverse the photo damage that's already been done? Well, there is one ingredient that has been shown to do that, and that's retinoic acid. It doesn't work quickly. It doesn't make these changes to fine lines, wrinkles, pigmentary dysregulation quickly at all. It has to work slowly, and typically over about a 9-month period, you start to see these real changes in the skin. Part of the reason I invented Klira was so that people would be able to use these products, these ingredients, in a way that doesn't irritate or harm the skin. One of the problems with retinoic acid is it's often very irritant to start using, and that can be because perhaps the retinoic acid is in a base that's not really quite suitable for the type of skin that you have. So at Klira, we've combined a base that really suits your skin, and then it has the very active ingredients of retinoic acid in that can then start to change and reverse some of the photo damage that has been done. If you'd like to learn a little bit more about photo damage, I talk about this extensively as it's one of my passions and it's where I spend a lot of my time doing research. But you can check this out either in medical publications or on my social media channels, where I kind of digest it and make it a little bit more palatable to the ears.